Just started rounds. The first patient, he presented with flu-like symptoms.
You're gonna be fine.
There was no exposure to fluid, no high-risk contact.
Are you certain?
I don't know if any of you are following the news. If you're not, you should be. There's something going around that's making people sick.
I must declare the virus highly contagious and fatal.
They'll die out there.
Everyone dies.
Once a day. I mean, once a shift, probably.
Blaze Sanchez works next door to the 7-Eleven, where once a day he stops by for a bite to eat.
Hot dogs were the main thing that I would come and grab to eat.
So when the Salt Lake County Health Department Sunday said some 2,000 people could be exposed to hepatitis A by an employee at that 7-Eleven, Sanchez panicked.
It's kind of just scary.
Tonight, we went to the Salt Lake County Health Department. They say since Sunday, when they reported a food worker at the 7-Eleven had tested positive for hepatitis A, they've set up a call center where on Monday alone, they fielded nearly 500 phone calls.
Oh, there you go.
We have been inundated with calls. We've had a lot of folks call in, and we're happy about that. We're glad the message got out.
Calling the county hepatitis A hotline. A worker infected with hepatitis A at the 7-Eleven continued to work while sick and handled food.
We're not aware of anybody infected due to exposure at this store, but it's too early to know because hepatitis A has an incubation period of 2 to 7 weeks.
People who came to this store from December 26th through January 3rd and used the restroom, or prepared a fountain drink or other self-serve beverages, or ate food from the hot food case, or ate fresh fruit, should call the health department at 385-468-INFO.
This is especially concerning for us because it could affect a lot of people.
As many as 2,000 by their estimates from the sales volume of the store.
It was just a scary concern, honestly. I got my little kids. And
Jason Carlson and his wife hurried in for a vaccine at a county clinic because he shops there regularly.
We get coffee there almost on a daily basis, and that was one of the things on their list.
His wife only shopped there once.
I just Googled it, and I noticed it was a liver disease, and it was something scary. Not really a cure for it.
Pretty alarmed until they got their shots.
We just had the whole situation when we had to do this, but yes, I feel a lot comfortable now that we actually got our shots.
People after 1996 likely to have been vaccinated for school.
Hand washing is the most important thing you can do to prevent the spread of hepatitis A.
Wash your hands after the restroom, before eating and before food preparation, and after you've touched surfaces in public.
You can really not wash your hands too frequently.
Just a couple of hours down Interstate 15, there's a hepatitis A outbreak which could pose a threat for Southeast Idaho. Over 2,000 people in Salt Lake City could be infected with hepatitis A, all stemming from a 7-Eleven. A worker kept working while they were sick and handled food. Then it was revealed yesterday people who visited 2 restaurants in Spanish Fork last month may have been exposed to hepatitis A as well. Anyone who used the restroom or ate at either Sonic Drive-In or Olive Garden Spanish Fork last month should take steps to protect yourself.
Utah County Health Department says customers may have been exposed at a Sonic Drive-In at 971 North Main Street, also at an Olive Garden at 1092 North Canyon Creek Parkway.
The Utah County Health Department says customers who ate at or used the restroom at the Sonic on December 23rd or 24th or the Olive Garden between December 21st and 30th are at risk. If you think you may have been exposed, you may need a vaccine, and you should contact the health department. Way food pantry has now been added to the list of affected establishments.
That comes as health officials say nearly 10,000 people are at risk from one location alone.
That laboratory-confirmed cases of contiguous flu are on the rise in the United States, with 11 deaths attributed to the virus in San Diego County, California alone. County health officials said 6 more deaths were reported this week, as were 3,873 confirmed cases of the illness. The Center for Disease Control and Prevention said that the flu season, usually about 12 weeks long, may have started earlier than normal.
In this country, the flu has reached epidemic proportions. The CDC reported today that the virus is now widespread across the entire continental United States.
In Ohio, Richard and Valerie Reben are mourning the death of their 4-year-old son, Jonah, from flu. He had underlying health conditions.
One of the most difficult things that I've ever had to do was tell my other children on Saturday morning that their little brother wasn't coming home.
The CDC reported 20 pediatric deaths so far this season. At this time last year, there were 3. Of the 49 states where the flu is widespread, these 36 are the hardest hit. California has had 42 adult deaths, up from 9 last year. Kentucky, 36 deaths, up from 4. And Oklahoma, more than 4 times as many.
Concerned about the flu, which could soon reach epidemic levels. Experts are very concerned about the strain that's spreading this year.
The CDC says this year's dominant strain, H3N2, is known to be especially dangerous, making its victims much sicker, much more quickly than other types of flu.
Historically, it's been associated with a higher incidence of mortality, both in the elderly population and in the very young population.
Some public health officials fear this is just the beginning. California already hit especially hard, with 124 deaths across San Diego and Los Angeles counties alone.
In terms of where we go from here, there is a little bit of unpredictability.
The flu reaching epidemic proportions, with 49 states now reporting widespread flu activity. That announcement from the CDC, the agency also stressing the most vulnerable groups remain people over the age of 65 and children younger than 5, because their immune systems are not as developed as those of older children.
Everything in sight that kids touch.
In Idaho, the situation so dire, cleaning crews are working overtime after an entire school district shut down this week. In North Carolina, this school also forced to close after 160 students got sick.
Tonight, the CDC is warning the flu season has struck early across the country. Here in Metro Atlanta, almost 200 people have been taken to the hospital with severe flu symptoms since the season started. Fox 5's Jacqueline Schultz joins us now live outside the CDC. Jacqueline, you've been told local doctors have been swamped with patients.
Yeah, in fact, they are so busy that the health department tells me that triple the amount of people have been going to hospitals all across Georgia because they've been feeling sick with something like the flu. Now, doctors say the symptoms of the strain this year, H3N2, are so severe, families have to watch out and make sure they take people like the elderly and children to the hospital if they're not getting any better this flu season.
Nationwide, visits to doctors have more than doubled. But in Georgia, the health department says doctor visits have almost tripled. Since flu season hit, officials say 200 people in the metro have been hospitalized. 50 in the last week of December. One person died.
The flu season is so bad this year in China is an unusual strain of the virus, B. Yamagata, is causing the flu outbreak. And this causes problems for 2 reasons. One is that the population doesn't have a natural immunity to the virus because they haven't had it before or haven't had it recently. And 2, it's not a virus that's included in the vaccine. So the vaccine is not protecting against the virus in China.
How does it get to that point? How does this
unusual strain evolve? Because I know it's a lot of predicting when you put together those flu vaccines for the upcoming year. You're really guessing.
Well, part of it's due to population movements, and viruses can get isolated in small groups. And so even though scientists try as much as possible to survey and see what viruses are most common, it's very easy for an unusual virus to pop up too.
Is what we're seeing in China right now indicative of what we could see in other regions around the world? How does China compare right now to other countries with this particular type of flu?
Well, actually, China is unusual in having the B. Yamagata. Both the UK and the US and also Australia have the H3N2, which is a more classic type of influenza virus.
With so many people traveling nowadays, I mean, can what's happening in one country move to the other and vice versa?
Right. Well, that's why you see all the Anglophone countries share the same virus, because you have travel back and forth. And in fact, in the U.S., the flu outbreak started very early, so Thanksgiving travel spread it, and the holiday travel around Christmas time spread it as well. And interestingly, in China, the epidemics tend to peak in December and then tend to die off in January when children go on the school breaks in January, whereas in the U.S. the peak tends to be a little bit later in February.
الحالة هذه عاد استوى خير والله عيفتها ربي شوي الأزمة هذا من نعمة يدلنا تبعدنا المرض ودلنا الهجج والغنى والله لين قد الناس قاوموا الحين خلاص ورد الصدق والله ما عاد يستر الواحد ذي كان مع مخبى خرجهن وذي كان اغترب تروح وذي كان يشتغل جلس وذي خلاص ما عبش ايش اللي حصل؟ كيف عرفتي ان انت تعبانه؟ كان وجعني ايش وجعك؟ بعدين كان وجعني رواتني
وبعدين لما مات واحد جنبنا وبعدين قالوا خلاص مات ليش نقول تصخر معي رويت عم حلقها قالت حلقي ما صار مغضبت لها حق الحلق فتشت حلقها أجيب كلها أبيض.
Yemen is on the brink of a new deadly epidemic. In the past 3 months, hundreds of diphtheria cases have been registered in the war-torn nation, with 20 deaths recorded. The World Health Organization is calling for millions of vaccine doses to be sent to the country.
According to the World Health Organization, at least 514 people in Yemen are believed to have been infected with diphtheria, with the disease killing 48 of them since the outbreak began in mid-August. The United Nations calls the circumstances in Yemen the world's worst humanitarian crisis, with 8 million people on the brink of famine and a failing health system. World Health Organization representative Dr. Nevio Zagaria warned that the spread of diphtheria was significantly more dangerous than the already widespread cholera because of its higher fatality rate. Almost 100 districts in Yemen have reported at least one diphtheria case, with a heavy concentration in the province of Ib.
Diphtheria is a bacterial disease that blocks airways, which can damage the heart and even lead to paralysis. It's spread through coughing, sneezing and contact with an infected surface. Symptoms include a sore throat, swollen glands and weakness. There are 4 vaccines available to prevent the disease. The World Health Organization says 1 million people in Yemen risk being infected.
Indonesia has one of the world's highest rates of diphtheria, even though a vaccine has been available for almost a century. There is public mistrust of vaccines, forcing health officials to make calming fears part of their efforts to contain the disease. The immunization drive and public awareness campaign began in mid-December with a focus on vaccinating children below the age of 19. It's in response to nearly 591 reported cases, a 42% increase this year.
In my opinion, diphtheria is a deadly disease and it needs to be prevented. So with these kinds of programs, we can avoid it through immunization.
More than 30 people died of the respiratory disease in Indonesia this year. Media coverage has led many citizens to seek out the vaccine.
Wabah seperti ini, penyakit ini panik banget lihat di TV ya.
These kinds of outbreaks and diseases are very worrying, as I've seen them on TV. It's deadly. It can kill both young and old people. It makes me very afraid.
Hospitals in Jakarta report an average of 11 diphtheria patients a day, most of them children.
There's another health emergency in the Rohingya refugee camps close to the Myanmar border. The Bangladeshi government health worker calls to families to come for urgent vaccination against diphtheria. UNICEF says at least 420 refugees are suspected of having contracted the highly infectious and potentially lethal respiratory disease. At least 6 people have reportedly died. Most Rohingya were never inoculated against diphtheria and other contagious diseases in Myanmar. Since the Myanmar government withdrew their citizenship 35 years ago, they've had limited access to medical care.
The UK is sending doctors and nurses to Bangladesh to try to save Rohingya Muslim refugees from the spread of a deadly diphtheria outbreak. In the camps sheltering people who fled violence in Myanmar, there are around 160 new cases of the bacterial infection every day.
These camps just inside Bangladesh are more than 600,000 Rohingya Muslim refugees who fled Myanmar. But their lives are now in danger from a killer they can't see and haven't been vaccinated against: diphtheria. The infection is spread by things like coughing. It affects the nose and throat. You can suffocate. 2,000 people have caught diphtheria and 27 have died. Children are most at risk.